using online health resources and tracking misinformation using technology. I think we're all going to do this. In fact, I'm actually doing this. I'm the passenger on my car. My daughter's driving. We're heading off to Montreal for the long weekend, and I'm really grateful for Daniel, Mir, and Sonia for helping us with technology. So, what are you going to learn today? Take it away, team.
Perfect. Thanks so much, Dr. Curnew, for that intro. So, as Dr. Curnew mentioned, technology is everywhere we go, as Dr. Curnew himself is tuning in while he's on the road. So, today we're really happy to bring back one of the Health Technology Club workshops for you. And in today's chat tonight, we're going to be talking about how to use online health resources and also how to tackle misinformation. So just in terms of what specifically we'll be chatting about today, we're going to start off talking about the YouTube channel for the clinic, as well as some quick Zoom refreshers on how to join in on our webinars, such as this one tonight. We're then going to go over how to tackle misinformation and talk specifically about what credible sources online you should use to find information. We'll then go on to give some really important medication reminders that are applicable to everyone, and then finally end off with some really exciting clinic updates to the website as well as the app, which Amir will talk about. So, as we all know, technology is everywhere, but it can also be very hard to navigate. Whether it's using different websites online or using your phone, it's really hard sometimes and overwhelming to know about all the different features that are available and know how to seamlessly integrate them into your everyday life. And that's what the Health Technology Club here is here to help you with. So, what we encourage everyone who's tuning in is to really take these topics with an open mindset. We know it's tough and challenging, but we're also here to support you in using technology to have the most benefit for your health possible. So we'll start off talking a little bit about YouTube and Zoom. So as most of you know, here at the clinic, we have a YouTube channel where Dr. Curnew, as well as all the different workshop teams post videos. And so we have 2 days in which the videos are released. Wednesdays, we have shorter videos released, which you will get notified via the clinic newsletter. And on Fridays, we have these webinars happening live at 7 p.m. Eastern Time here on Zoom. And you can also join in on YouTube. And those are also recorded and posted afterwards on our channel. So I just wanted to take you through how exactly you can navigate the YouTube channel. And what's so special about our videos? Well, first of all, they're created by the wonderful volunteer team here at the clinic, as well as Dr. Curnew himself. So they've got a lot of different individuals involved, lots of different perspectives you can hear from. And they also have really cool animations that will help you understand topics better, like blood pressure, cholesterol, and exercise, to name a few. So a lot of the videos, especially the ones on Wednesdays, are shorter as well. So it's really easy for you to tune in, watch a quick 5-minute video, and learn something new along the way too. So it's very exciting. And to access our videos, essentially you would go on to youtube.com, and in the search bar at the very top, you can type in Greg Curnew. And there you'll find this wonderful picture of Dr. Curnew as well as his name, and you can go ahead and click on the icon, and that will take you to the main homepage of the YouTube channel. So here you can see it's Dr. Curnew's page, and so there's a couple of different tabs at the top that you should know about. So the home page itself, and then there's videos, playlists, channels, discussion, and about. So if you click on the videos channel, for example, you can find all the videos that have been posted. They're uncategorized under this tab, usually from most recent to least recent. You can also see how long the video is, as well as the title of the video, so you can pick and choose depending on what you want to listen to that day. And if you're looking for very specific things to watch, you can also view it by playlists. So for example, if I click the playlist tab at the top, you can see they're divided into different things like medication club, exercise club, our technology playlist as well. So it's really great if you're looking for a very specific topic you want to focus on. You can click on that playlist and it'll show you all the relevant videos from that topic. So those are some examples again. If we wanted to look at cholesterol-specific videos, some examples that we have here, especially ones about statins, cholesterol-lowering medications, to name a few. And you can also use the search bar to type in things like hypertension, in which you can learn more about understanding high blood pressure, connections with COVID, and how to manage your risk factors for that as well. And then here's an example of diabetes, so things like complications, screening, management. So definitely a lot of different topics there for you to learn about, depending on what your personal needs are. And what videos do we have specifically to help you with technology? Well, we have a technology playlist available on that same YouTube channel that I showed you. So we've covered a lot of different topics over the past few years. So in our workshop series, one of the first ones we did was how to create an email. And this is a 40-minute long video that walks you through step by step on how to create a Gmail account, how to compose an email, send, receive, etc. So you can follow along there. You can pause, rewind, and follow it step by step for yourself as well. So it's very helpful in that way. We have another one on video calls, so how to use things like Skype, WebEx, and Zoom, which are very common these days, both for healthcare appointments, but also to stay connected to family and friends, especially during the times that we live in now. We had a third workshop on how to navigate social media, specifically how to use Facebook. So again, going through how to make an account, how to add friends, how to share photos, which was also very helpful during these COVID times. And then we have another one on how to use YouTube that kind of summarizes what I'm sharing with you here today as well. And then recently, we've made a lot of videos on how to access your lab results online, so both using Life Labs as well as DynaCare. And as you can see, these are very short 10 to 12-minute videos, so very easy for you to play the video on the side and even follow along and get the support you need to be informed about your own health. And a few others here. So we made one on a couple on how to use technology to reach your exercise goals. So in this video here on the left, we looked at MyFitnessPal, which is an app that you can use to both keep track of your weight, diet, as well as exercise to improve your health. And then we touch on a few other technology resources in that second video here on the right. So lots of different things for you to choose from, but hopefully that's helpful. And if you ever need any help on how to access a video, or if you aren't sure which videos to look at, feel free to ask any one of us, any one of the volunteers, or Dr. Curnew himself, and we'll point you towards the right clip to watch. And then we'll transition over into chatting a bit about Zoom. So as I mentioned, on Friday nights at 7 p.m. Eastern, we have our webinars happening live on Zoom, which we're using now. So for those of you who want to join in on Zoom, you're able to share your wonderful faces with us and unmute and use a chat. So it's a lot more interactive way for you to be involved in our webinars. So um, to essentially join in on Zoom, you can go on and Google Zoom, and once you get onto the home page, you'll see this icon at the top right that says join a meeting. So you can go ahead and click that. And once you click join a meeting, it'll ask you for a meeting ID or a personal link name. And so basically in the meeting ID, you can enter in a series of digits. So for example, this here is an example of someone, if they were to invite you to a Zoom meeting, usually they'll send the link itself, but also the meeting ID and password. So this series of numbers is what you would copy into that box there. And Zoom should then go ahead and start launching the video. So once it's launched, you can go ahead and click join with computer audio if you are joining on your computer or laptop, and it'll then connect you into the meeting. So if you are joining in our webinars, this is kind of what it'll look like. The Zoom panel, once you've joined, there's a few different buttons on the screen, so it can be kind of overwhelming, but I'll try to walk you through some of the main ones here. So you're welcome to mute or unmute your microphone. So that'll usually be on the bottom left-hand corner. We ask that when we're presenting that you just stay muted just in case of any background noises or feedback, but feel free to unmute at any point, ask your questions, comments, share your thoughts throughout our webinars. You can also stop or start your video. So if you would like to show your face, feel free to start the video, or if you want to just have it in the background, you can also turn your camera off. There's also other features such as you can see the participants list, so you can see other people who are on the call. You can also use the chat function. So if you ever have any questions or if we ever drop any links in the chat, you can click that chat button and access them that way. And then there's a closed captioning option as well. If you have any accessibility needs or would like the transcript to be shown at the bottom, you can go ahead and click that too. So just again, some webinar reminders to sum up. Try to keep your mic off, but feel free to unmute whenever you would like to speak. You can start or stop your video. And like I said, the chat function on the side on the right-hand panel will also pop up for you to use. And so for our specific webinars that happen on Friday nights, for those of you who are subscribed into our newsletter, you will receive basically every week on Friday the topic, such as here, as well as who's presenting it. You'll receive a little description about it if you're not sure, that I'll talk about what we're going to cover. And then essentially we've linked directly a link for you to click on, and that'll take you right to the Zoom link. So it's very easy. And if you aren't already subscribed to our newsletters, we'll show you how to do that near the end when we walk through our website as well. Okay, and with that, we'll go on to tackling misinformation. So one thing that, we have a lot of comments and questions come in about at the clinic is where people get their health information from. So a common answer to this question is, of course, Google, which seems to have the answer to everything within seconds, if not minutes. So of course, Google is a really great resource and there's lots of different health resources online, but we also have to be wary of ensuring that that information we're receiving is credible and essentially trustworthy and from a good source that we can actually rely on. And so that's what we're going to talk about now is how do you actually know if your source is trustworthy? So quite surprisingly, there's a lot of people who use the internet to find, of course, their health information. But for example, Stats Canada recorded that during the first few months of the COVID-19 pandemic, there were 96% of Canadians who used the internet to find information, but found that the information they saw was actually misleading, false, or inaccurate. And I think this is a really important stat because especially during the pandemic, we saw how there was a lot of different sources of information coming through, but a lot of it is also inaccurate. So we really want to make sure that we are getting the most credible information as possible, especially to prevent any harms to ourselves or our loved ones as well. So some key questions for you to ask when you are sifting through information, whether it's online or elsewhere, is first of all to ask who wrote this information. Secondly, to ask when was this information released? And thirdly, to ask can this information be verified? And the reason I say these three questions is because it'll really help you narrow down to the credibility of the source. So who wrote this information? We want to make sure that this information is written by someone who actually has a lot of expertise in the topic. So if we're thinking about healthcare information, we're thinking about the variety of healthcare professionals we have, such as physicians, nurses, nurse practitioners, OTs, PTs, pharmacists, for example, to name a few. And you also want to make sure that this information was written from a very objective point of view. So, a lot of articles or information online can be written with the intent of getting you to sometimes subscribe to something or purchase something or lead you down one way or another. So we want to make sure that the person who wrote this information was neutral and does not have a lot of biases that they are involving in the sharing of their information. For when was this information released? Of course, things that are applicable many, many years ago may not be as applicable now, especially when it comes to your health. So we want to make sure that we are accessing information that is relevant and up to date. So having a quick check on the date that the article was published, for example, or when a study was done would be helpful for you to know how well to trust it. And then can this information be verified? So for information to be verified, you want to make sure that there's multiple sources that are telling you similar or same things. So if you found multiple articles online by experts that are all recent telling you a certain health fact, then you can have a bit more confidence in that this information is probably verified rather than just finding maybe a one-off article that says one thing, but a lot of other things seem to contradict it. So just making sure you do a thorough check of the information you are accessing is also important. So again, who wrote this information? We're looking at their credentials. Are they an expert? What area are they talking in? And why would they write this? So ulterior motives and any biases. So a note here is that websites that are made by the government, so especially those that are ending in .gov, such as a Canadian website or public health organizations themselves, are usually really reliable and will usually have very up-to-date information. So especially during the COVID-19 pandemic, we saw that a lot of health authorities locally were constantly updating the number of cases that were happening, the number of vaccines that were given out, and important facts like that. So you can really rely on them because their job is to really make sure that that information is getting to you. And I just listed some examples here. So things like the World Health Organization are crucial. They have so much information on a variety of health topics, as well as advice for public and a lot of information on public health response and surveillance as well. And then here again is the Canadian government website that talked about COVID-19. So you can go onto this to look at what the current situation is, for example, different policies around travel or immigration, as well as other public health rules and regulations that are really important to keep in track of these days too. And this was kind of an old screenshot from the Hamilton Health Sciences as well, and the city of Hamilton, again, showing the number of active cases, as well as the vaccination statuses. So again, a lot of the citywide or health authority or more government level websites are all usually very up to date and reliable. So when was this information released? So again, I did mention date, but of course, older doesn't always mean it's not trustworthy. So you just have to use your judgment a little bit here to understand whether the information you're accessing requires to be time sensitive or not. And of course, if you're not sure, please don't forget that you can use your healthcare team in person as a source of information too. So even though we're encouraging use of online resources, they're also, of course, there to chat. So anyone at the clinic would be happy to answer any questions you have as well. And again, can this information be verified? So for a quality check, just doing a thorough search and using additional sources to verify. So just putting it all together as a summary, you want to consider the source that it's coming from. You want to read beyond the headlines, so beyond very flashy titles and headlines that catch your attention right away. You want to get into the details and think about, well, what's the whole story here? What are the different perspectives at play? You want to check the author, you want to check their credentials, as well as any ulterior or motives they might have or any biases they might have. You want to look for supporting sources, so check the references of articles, for example, or check multiple news sources if you're trying to make sure that this information is in fact valid. You can check the date to look at the time frame of it. Make sure that the information is not a joke. So sometimes a lot of articles online might actually be satire and not true. So just making sure that you're aware of that too. And of course, asking the experts. So reach out to your healthcare team if you're ever unsure as well. Okay, and so with that, we'll move into our medication reminders for tonight. So medication reminders are something that we always highlight in a lot of our webinars, and it's because they're so key and really important to drive home. And are you a medical error? This is really important to think about because every year there's 7,000 preventable deaths just from medication errors alone that occur within the United States, for example. So keeping track of the medications you are taking, as well as really understanding why you're taking them, is crucial to make sure you're well informed about your health and are really doing the best that you can to be responsible and accountable for it as well. So, what are some causes of medication errors that we just talked about? So, the first one is miscommunication. So, this often happens between the healthcare team and patients. And one thing you'll note that we always ask for when you come into clinic is to bring a list of your medications, an up to date list of your medications. And so, when that list is not available or when patients aren't able to remember the medications they're on or for how long they've been on or what dosage, this can really make it difficult for the healthcare team to make decisions about your health and to really decide whether you should be switching medications, for example, or how it's doing for you. So miscommunication is a really big one. Another is abbreviations. So, for those of you who may be on many medications, you'll know that a lot of the medications or conditions have abbreviations that might be missed or have very similar names. So, just being very clear that you have the right name written down and that you're not getting confused between your medications is also very important to avoid those errors. So, again, similar medications with similar names or doses that could look alike. And the last one is really feeling overwhelmed. We know it's really easy to, tell you to keep track of your medications, but we also acknowledge that it can feel overwhelming, especially if you're on a lot of medications. So it can be hard to keep track and know exactly what you're on. But we have some tips we're going to go over today to hopefully help make that process a bit easier for you, and to also ensure that you do not end up experiencing any medication errors of any sort.
So one thing, Sonia, I encourage people to also do is to actually bring in the pills themselves. And we'll talk a little more about that, is that who's prescribed what. A lot of people change medications, people stop medications, people have potential issues. So always keep a list on you at all times, and also make sure that when you come in, bring the medication, put them in a plastic bag and bring them with you. You can always do that. Never and always do every visit. I don't want to keep hearing you had that last time. This should be done on a regular basis when we need to. Go ahead. Thanks so much.
Yeah, absolutely. I think that regularity and consistency is very key, because your medications could be changing between the visits to the clinic, or you might be experiencing new side effects, or even if things are going well, it's really important that you just keep that routine going. So again, the good news is that these errors are preventable. So how exactly do we prevent them? So again, a medications list is key. It's really important to have one for this reason. And the first reason is because when you have a list, it ensures that we have the most updated and accurate medications for you. So again, if you don't have that list that really outlines all the medications you're taking, it could lead to harmful diagnoses, or we could end up prescribing medications that might conflict with the ones that you're already on, or might do the same thing. And so it's really important for us to have the full picture of what you're experiencing on a day-to-day basis with your health. And so that list really ensures that we have that. The second reason, of course, is that we don't know what other medications you might be taking outside the clinic, such as those prescribed by other doctors. So, of course, there's many different healthcare professionals that are involved in your care. So having a list that summarizes all the different ones you're taking will cover our bases in that sense. And the third reason, and probably the most important one actually, is it allows you to keep track of your own health. So the more engaged and accountable you are in knowing the medications you're taking and even understanding what each medication is for, will let you stay organized. It'll let you allow others to support you when you need help, and it'll also be better for you to in order to stay healthy. So lots of different reasons why you should have a list. So what exactly does a good medications list look like? So you can see an example of one here. So you can have your name at the top, an emergency contact, for example, if it gets lost or misplaced, and the date that it was last updated. So again, when you're coming into clinic, having the most updated one is the most helpful. But essentially, you want to not just have the name of the medication, but also a few other important elements to it as well. So you can write the name on one column, and then you can also write the strength and the frequency. So what dose are you taking and how often are you taking it? And then the condition the medication is taken for. And this is especially important for yourself so that you know what each medication is doing for you. And then also the physician who prescribed the medication. So again, a very important column, especially if you are having multiple healthcare providers involved in prescribing you different things. And then you can also have a small notes column. So Maybe you could track there any side effects that you've experienced recently, how well you've been with taking the medication. For example, are you taking it every day? Or is it harder for you to take? Any notes that you think or any concerns or questions you have that you want to bring up to the healthcare provider would also be really crucial to add in here. Also on the list, we encourage you to put any allergies, which will be helpful when we are prescribing new medications, and then also information about your drug plan and what pharmacy you go to as well. So this is a list that you can make online. You can make with pen and paper, but really try to make sure a physical copy would be the best so you can bring it in and show Dr. Cooney, for example, physically. And it's even more helpful to make a binder of your medications list and all the other health information you have as somewhat of a scrapbook so that you have a whole package that you can kind of carry around regardless of which clinic you're going to and whatever concern you're going for. And then some other reminders. So when you're writing the name of the medication, for example, be aware that every medication has a generic name as well as a brand name. So just try your best to be aware of the spelling and make sure that you don't confuse any similar names together. There's also dosing and frequency. So how often are you taking this medication and how much are you taking it, as I mentioned before? And then again, the purpose of the medication. So what are you taking it for? And if you're not sure of this, make sure you ask that to your healthcare team when you go visit them or when you're prescribed a new medication so that you're able to kind of keep track for yourself as well. All right. And with that, we're going to go on to talking a little bit about the clinic website as well as the app. So if you haven't already
So
heard,
just one more thing about medications. I see this over and over again is that it's really important to know what doctor is prescribing that medication to you. And if you have a problem with that medication, it's ideal if you can to talk to the doctor who prescribed it to you. You can decide if it's still the right dose, right medications for you. Also, knowing how many pills you have left. And it's really kind of important to figure that out. Now, one of the things that I find that when in pharmacies and many prescriptions are prescribed at different times, different renewal dates. What I'm trying to do is that when I see you and evaluate you, I want you to leave and I'll give you a pill that's 3 weeks, enough for well over a year. So if we're on chronic medications, we'll make sure the right medications. And you need to go to the pharmacist and make sure that your prescription renewals are all set at the same time. Because too often is that you don't want to do one medication this month, another medication 2 months from now, another 3 days from now. So you have to go to the pharmacist and grab them by the collar and say, Mr. or Mrs. Pharmacist, let's get this all on the same renewal time frame so that we can all work together on this. It's frustrating to you, it's frustrating to myself, and I know there's different rules and different things, but it might add an extra prescription dispensing fee, but really being on the same page will make life so much easier for everybody in the long run. So you don't want to make medication errors, and the best way to do that is when you're at your appointment. And I don't want to hear anymore is nothing's changed. You should know. The answer is you, as the individual, as the patient, should know what you're taking and know when you're going to be running out. I'm driving to Montreal. I look at my, your gas when you're going to be running out, or if you're electric car, when you're going to need that electric charge. Is that so? This is the plea right now: is that we are spending an hour to 2 hours every day redoing medications, and I'd rather deal with emergencies than deal with your medications at the right time, right place. So just think how you can be part of the solution, part of the problem, and if you're on a blister pack, sometimes you don't know when they're going to be renewed. But you need to go to the pharmacist, work with your pharmacist and with your physicians to be on the same page. Now, some family doctors like to renew all medications. Some family doctors just want to renew certain medications that they started, went to specialists. So let's make a plan of action that really works well for you, and so that you never have to get a prescription renewal only at your appointment preset times. Does that make sense? And if you be running out of medications, call, book an appointment, and sort this out. And check when your appointment's coming up, what pills you have, how many pills you have left, and how many renewals you have. If you don't know, call your pharmacist before your appointment with myself so we can make sure that when we finish our appointment, you have all your medications. And I'd like to give you enough to last you a full year if we can. Sometimes we'll make some changes. That's okay. But let's work together on this. So this is really, really important. And that's why we're developing, one of the reasons we're developing this app as well. Um, every day this is happening, and every day this should not happen. You should know when your medications. I'll be quiet for a little bit. Thanks for listening. You figure your way. Thank you.
Thanks, Dr. Curnew. That was really well said. All right, so yeah, as if you haven't already heard, there's been a lot of volunteers that have been working really hard over the past few months to create a new website for the clinic. So we have a lot of resources and a lot of different focus groups that you can explore on this website. So I just want to take a few minutes to highlight some of the work that's been done on it. So the website itself is www.curnewhealth.com, and essentially I have it pulled up here. So this is the home page of the website. So essentially, this website is the main hub where you can find out a lot about what's going on in our clinic, as well as how you can keep track of your own cardiac health. So scrolling down on the main homepage, you can read some of the latest clinic news. So for example, here you can see that there's tennis and softball that happened last week, for example. And you can also look at some of the featured videos that we have here, such as recipes, suggestions, and different topics about medication. And you can read a little bit more about the clinic vision, as well as the YouTube videos itself. So on the homepage directly, you can see that there's a link here that will redirect you to the YouTube page. So if you click that link, it'll take you back to, you can see the screenshot here, the channel with all the videos that I talked about earlier tonight. And then here, there's also different support groups that you can join as well. So if you click on join our support groups, it will take you to a Google form where you can essentially sign up for the weekly newsletter where you're going to get the link for the Wednesday video as well as the webinars on Friday as well. So lots of different resources here. And the other thing I'll highlight here is at the top. So the top right, as I mentioned, we're on the home page right now, but you can also click focus groups under resources, which will show you all the different groups that we have going. So weight loss, mindfulness and meditation, sugar club, as well as smoking cessation, just to name a few. And if you click on these individual links, you'll be able to sign up for that focus group. So these are really great opportunity for you to get involved in really a community where you can meet other people, other folks who are working on the same health goals towards them as you are. At the same time, you can get support from some of the volunteers, as well as Dr. Curnew himself directly, in how to make progress towards those goals. So it's really helpful if you want to take a look at the schedule, see what you're interested in, and sign up accordingly. And they all run, as you can see, on a variety of different days and times, so you can choose one that fits with your schedule. And then some other resources at the top, if you go back here, there's also a medications page. So a lot of different classes of medication that you can look at in terms of how they work. So for example, a small description here and some examples. So this is also really helpful because I'm sure that we've all been in clinic and heard these names thrown around, or maybe you're prescribed on some of these themselves. And if you ever need a refresher or are looking at your medications list and don't know what something does, this is a really great way for you to get a little reminder about it as well. And then finally, under resources, we have frequently asked questions for appointments. So really helpful if you're coming in for an appointment, whether it's virtual or in person, to read through these reminders. This will make your visit a lot more smoother and ensure that you have all the right information you need and that Dr. Curnew has all the right information from you in order to make progress towards your health goals as well. And then we've got some information here on some diagnostic testing. So what an echo is, what an ECG is, what a stress test is. So that is also helpful as well. And then finally, I'll just highlight the contact us page. So we've got the number, the address. If you ever need to reach out, you can send us an email here and we will be happy to get back to you. So it's really exciting. This website, has taken a lot of hard work to make, and it's very well integrated. It has a lot of great resources and it's constantly being updated. So please make sure that you check this out. One other thing I'll show you is how to bookmark it as well. So in any case, if you're on a website and you want to save it for the future, there's a little star icon here at the top. So if you click that, you'll be able to bookmark the website so that you can access it a lot quicker instead of typing it in each time as well. So yeah, that is the website there. And I'll also, so this is just a reminder again about the focus groups and how you can sign up. And then, yeah, I'll chat a little bit about the Clinic app. And for that, I'm going to hand it over to Amir.
Thank you. Yeah, my name's Amir. I'm a little bit about myself, just third year neuroscience student at McMaster. For the past little while, we've been putting in a lot of hard work in developing a new app. At the moment, right now, we have a few features that are shown here. You can actually basically book appointments that will give you text reminders about to confirm the appointment and cancel it. You can actually confirm and cancel the appointment through the app, and the clinic staff will be notified about that. On the left, you'll see we have a Ask Us info channel. So you can send questions to the clinic, and we'll answer them on every Friday on these weekly webinars. And on the right, you'll see our appointment confirmation screen. And once again, just on the left, we have an FAQ section where we just have frequently asked questions about your health, apps, technologies, coming into appointments and these sort of things. Right now, we haven't put out the app on any stores yet, but if you're interested, in the description of this webinar, we have a link to sign up for to be the first to use our app. We also really want to hear from you what ideas you might have for the app and what things we can do great with, and what ideas you think we can add to the website, and any feedback you guys have at all. We have another form in our description for that. We really would like to hear from you. Thank you very much.
Awesome. Thank you so much, Amir. So yes, like Amir mentioned, there is the feedback form linked in the YouTube description. So please fill that out and definitely check out the app. Amir and the rest of the team have been working really hard on it, and it's really cool to have a whole app that is able to help you with your health goals. So definitely check that out. And that kind of brings us to the end of the webinar today. But before I end off, I wanted to also hand it over to Dr. Curnew if you have anything else you wanted to add on for folks who are tuning in about technology reminders or elsewise.
Well, first of all, I want to thank everybody for participating. Sonia initially developed our first or one of our websites, and we're up to a brand new one. We had a virus issue at one point in time, but we have really a really nice website. Daniel for taking over all this technology, and Amir for just an amazing job of really bringing us to a higher level. This app will be an important app, and will have lots of features in it. One will have your medications, and if all goes well, before we see you, you have to update the app, or your pharmacist will actually know what's going on. We'll have appointment reminders. We'll have the scrapbook information, and all the stuff will be on the website or on the app as well. So this is really an exciting time for all of us. Now, technology, as we were driving, is that we lost connectivity for a while, but we got back on there. That's part of technology. Sometimes it works, sometimes it doesn't, but it is very, very important. So one feature is that getting medications right is a big problem. It is the number one source of medical errors. Assume, and I'm taking gliding lessons how to fly a flight, and every time you go through this checkbox before you fly, and this is what airlines do, is that do lots of checkboxes because errors are common. So one of the check boxes before your appointments will be medications. So take a look at your medications, who prescribed them, how many pills do you have left, what they're there for, what are your concerns about medications, and so part of our discussion is medications, and let's look at that. And if all goes well, you should have enough medications to last you for a full year after you see me for the medications that I'm responsible for. Make sure you go to your pharmacist and that you're on the same page. That the pharmacist will update them all at the same time and change the renewal dates so that they all match, or at least match till your next time you come see me. Technology, learning about different things. There's so much to learn. Um, and things are changing all the time. How to get good information. I think you saw some examples of that. So I think this is a fantastic opportunity. Most of us take our health for granted. And you know, and what people are saying is that no news is good news. No news is no news. So you learned about look at lab information, then get that lab information from Gynacare Life Labs, sign up for that, get that available to you online. And if you can't do it, get some smart person in your family to help you with that. And look up the video on what's in your blood so you can actually understand and interpret that information. Um, so much to say, so much to learn. And I didn't know what Zoom was until a couple of years ago. I heard the word. It's not a sneeze. It's actually something really important. And so taking charge of your health and being part of your health is such a wonderful thing. So I want to thank everybody for looking at that. And Daniel, what's your thoughts?
Yeah, I mean, my big takeaway, and honestly just want to reemphasize, we've said it a bunch, but it's really important to just know what your medications do. Whether that's going onto our website or our clinic app and actually where we'll have our, FAQs or medication information and actually reading up what does, atorvastatin do or Lipitor, or hey, I have this medication called bisoprolol. What does this actually do? Do your own research using our like website or our clinic app, but or as well, coming into your family doctor's appointment or coming in to see Dr. Curnew or speaking with a student. We're also more than happy to help you and sort of inform you as so you can take notes and sort of remember and keep a list and figure out what does each medication do, and so you can take a greater involvement in your own health. But yeah, just pretty much you take it. You got to take initiative in learning about your medications and keeping on top of these things.
Fantastic. Well, listen, I don't have anything more to say, but just keep working and keep learning and enjoying the process. Um, there's so much to learn, so much to get better. And I want to thank everybody for participating. Any final thoughts from Sonia or Amir?
No, I think you and
Send us,
Daniel summed this up really well.
thank you, and send us your ideas. We have lots of things. So if you go back to the website, you can see that last Saturday or last Sunday we had a tennis game, softball game, and so we announced that, and we had that there. We're going to have other things, and um, so I think we're going to try to is that I think on Mondays, myself and Adam are going to be going the Wentworth Stairs again. We're going to start that up again. So and I forget if he's coming in Thursdays or Fridays, and have fun and let's be a team together. So I'm going to bid everybody a great night. Any final thoughts from anybody else? Daniel, you get the last word.
Yeah, I mean, yeah, just stay tuned because we'll have some more fun activities and we'll be posting about that on our website and our social media. So yeah, just keep an eye out for these things. Keep checking our website.
And don't say I get the information and I haven't looked at it. Get the information, look at it, scan it, spend 5 minutes every night just taking a look at things and decide what's the important things for you. I forget 90% of what I've learned, so repetition is important. Digesting it and get more information changes. Good night, everybody.
Good night, everyone.